No.
Okay, acceptance of the posted agenda, motion by Mr. Becker and second by Bridget. All those in favor say aye.
Aye.
Opposed? Carried. Now it's review, approve the prior board meeting minutes from July. Everybody have time to read through those?
Microphone went quiet.
Oh, I bumped it, maybe that was.
No, it just goes to sleep. Okay, now.
Okay. So if everybody's had a chance to review the minutes, is there a motion to accept those minutes?
Motion to approve.
I'll second.
Okay, a motion made and seconded to approve the minutes. Is there any changes that or anything more discussion? If not, all those in favor of say aye.
Aye.
And those approved, nay, carried. We now are going to the public comment. Members of the public will have a 10-minute block of time to comment on today's agenda. Members of the public must be present at the beginning of the meeting or comment period will be waived. Public comment period may be extended or curtailed at the discretion of the chair. And I don't see anybody here. So I'll leave it open for just a little bit. We'll move on to number 5, board meeting update for live streaming. Jerry.
So again, we've been making progress over the last couple of years. We've been actually live where people can log into Zoom and visually see our meetings. And we've worked, our MIS has worked really well with the MIS at the courthouse. And today it's recorded and it will be uploaded by the courthouse so everyone can see the meetings. Again, our strive for transparency on who we are and what we do here.
I'd like to make a comment on that. For years up at the old courthouse, we usually have meetings in different meeting rooms. So there's about 4 or 5 of them. But today with the new building and stuff, with the new county board room, there's kind of an emphasis to have everybody, all the meetings taking place there where it's recorded and stuff as well as you guys do here. The only difference would be is I know tomorrow executive finance has a meeting talking about trying to get uniformity as far as what is live at the time and what is broadcast at a later date. So there'll be a discussion on that tomorrow. But at the highway department now, they have brought the committee meetings to the county board room as well. And so I don't want to speak wrongly, but I believe that healthcare center is the only one that hasn't had a meeting there. And I would like to see if we're gonna have them all at the county building at the board meeting. And that's just a suggestion. I personally would like to see it. And I know there's a lot of other people like to see it there too. I don't know if that puts some stringent or some issues with you folks out here. I know that you have different employees that come in and speak to this board here as well. But I just think that would be great. If nothing else, Jerry, at least try for a couple, 3 months, see how, so maybe it doesn't work for you guys. I don't know.
Right. You made a good point. I operate, again, we are part of the county.
Yep.
And I do operate a little bit different than other managers where, I bring lots of stacks of sensitive information. We have had a meeting there once when there was a previous board there. And it went well, but some of the situations were quite challenging. We do have a lot of employees that periodically will attend. our bylaws do identify, which we may have to look at, that specifically the Board of Trustees shall perform following duties in addition to the aforementioned guidelines and responsibilities. Shall tour the facility on a regular basis to ensure compliance with minimum standards. Which means you will see, as we've done in the past, where we move around to many facilities and that's where we have our meetings. Now, could we work, could we discuss potential future of including that courthouse in that routine? But again, I think it's further discussion would be something we could talk about.
Sure.
I'm not like 100% opposed. I just think that, our mission, and the people that are involved would have to discuss this at an all-staff meeting too, to see what their thoughts are, because we do have a lot of individuals that will not go to the courthouse and participate, but it's worth a discussion.
Yeah, and that was exactly my concern, was the bylaws stating that we. And in the past, in order to do that, we just met at those facilities as opposed to doing a separate tour. And we just incorporated it all
I see.
in one meeting. But yeah, maybe we could figure out some sort of like a hybrid version of that.
Or involve, a meeting at the courthouse where we're at least present and with the understanding and knowledge that our bylaws do direct us to have you guys move around between all of our facilities to ensure that we are meeting the minimum requirements for care and treatment.
So who sets the bylaws out there?
Board of Trustees.
We do.
We do.
I just to add to Rich's, the highway moved there, but I think, what is it, for 3 months or 6 months?
Trial for 3 months, but I know that Neil likes it there.
So, I mean, and who knows, like you say, you run it this way, Neil likes it there, next guy will like it there.
Yeah.
It's because the material's right there.
I think
I can see both sides of it, the material's there, material's here, so if you have questions, you get the answers right away. It's
up for, I would be willing to have some further discussion.
I just wanted to
I
get
think-
clarity, not that I'm pushing one way or the other.
Yeah, and my concern is how many people then come from the highway department to the county for those meetings?
4, 5.
For
Employees you're talking?
employees, yeah. And that would be my only concern, is that, okay, if we're gonna have a meeting, how many employees from any specific facility here attend the meetings that you have to pay them? 'Cause we obviously don't want their budget to go up because they have to go there instead, but yeah, I
I'm
think
just
it's
trying to
definitely,
Make it more uniform so
makes-
everybody
it
is.
makes it uniform,
Yeah.
yeah.
And it's and I'm up for the discussion. I know, we have very responsible people in charge when we're out of the building. It does make it a little sensitive where, a situation happens and then I would have to have another licensed administrator leave. Because if something happens, let's take, Mr. Minch over there, is that if there's something that happens here, he actually has to fill out a report on certain circumstances that he has to report to the state within 2 hours. That's how nasty it gets with the state of Wisconsin.
Well, you have had to leave
Yes.
meetings before because if inspectors show up.
Yeah,
I know,
So
I know
there's-
that.
which they showed up yesterday, so it's good that we have our meeting today. So, but we can sure discuss.
Something to think about.
Yep,
And I was just gonna mention too, that if it turns out that all the meetings are just gonna be recorded and shown later, it shouldn't matter where we're at,
Then it would be.
right? It's just
You can work
and
in a
my,
routine.
my goal would be that all meetings
maybe
are,
we can work in a routine where we can down there period.
Yeah.
there you go.
The only thing would be is if the board did make a decision that everything is live, then we would have to look at this again.
Yep, and they would have to take into consideration of our licensed administrators out here because we have 2 hour state reporting. We have 4 hour state reporting. We have 12 hour reporting. That's not a simple task. That,
And that's something you would need to talk
Yep.
about.
so to make it blanket across
Yeah, yeah.
would not be sufficient.
Is-
Joe, I know Joe can expound on
When
that.
did you say that meeting was, Rich?
Well, it's on the
It's
agenda
on
for
the agenda
executive finance
tomorrow morning.
tomorrow.
Tomorrow morning, okay,
Yep.
so that's not timely enough.
No.
But I was gonna say, maybe Jerry can make a list of concerns or conflicts, whatever that might be, and give them to the committee for conversation. Obviously, it's tomorrow, so you might have to revisit it maybe
Yeah,
or something.
It's-
And it's not nothing we have to do right now.
No, it's not.
And so this, like I said, this is being recorded and it's going to be uploaded. So it'll be out on, is it YouTube, I suppose, is where it gets put?
And onto the county website,
Okay,
same as all of the other board meetings.
Good enough.
okay.
Good start.
Next on is the review approval of partial June 26 and July 26 expense voucher reports, Jerry.
We are gonna start with, the longest one, dated, and the first one dated upper left-hand corner vendor summary, 7/15/2026.
Yes.
Just for educational reasons, we've talked about this before, 74295, 89,937.93. On page 1, that is our pharmacy pass-through. That is for the medications for the IMG, specifically that we bill back to via contract to all of the different counties across Wisconsin. Different one on here that you have not seen for quite a while, I haven't either, is 74298. Capsa Solutions, 1,094.09. So when they come through periodically, or it's a new vendor, or a lot of them change their names, I like to point those out.
Please do.
And that is specifically for our nurses, medication card keys. There's no copy, so they have to be ordered specifically from the company. You cannot make duplicates, it's just a security. Page 2. This you only see annually, 74330, Leading Age Wisconsin. That is our annual dues for all of our facilities, $18,635. And that is part of the entire industry participates with Leading Age, where we get a lot of legal updates. We participate partnering with them, everything from job openings to educational things to legal advice and legal interpretation, because the codes and the regulations change so frequently. Seven, 4, 3, 6, 4. That is an ongoing project with Swanson Flooring. Part of our bid process that we did quite some time ago. That's for Pigeon Falls facility. That's what I have targeted, so feel free to ask.
Did they get that new, out of the, Pigeon Falls? Yeah,
The rooftop?
yeah,
It's in the process.
process, huh?
Yeah, so right now, the bid, we signed the agreement. And it's just setting a date, and they'll have to get the cranes here and get all that
Cool.
taken care of, so.
Good.
Any other questions on this one before I go forward? I apologize, I didn't get them out. I wanted to get them out a day before, but things kind of happened. Hope you had a little time to read.
Lori, Can you send me back the attachments, like just inadvertently deleted all?
Well, for the board meeting?
For the audit.
Oh, yeah,
But just resend it to me.
okay.
You'll find it in here even in the
Okay.
deleted.
Any other questions on that one?
So that was the 7:15.
7:15.
Any other questions on that one? Otherwise, we can move to the other one, which is 7:26
Wait,
or
what is,
7:27, 7:27.
what is that Unisign Corporation?
That's
So,
their meals.
yeah, so the Unidine Corporation, is our contracted agency that provides our meals, 3 times a day, snacks, and they partner with, they're actually part of Compass Group, Unidine, and then we also use 2 vendors. We use Reinhardt and, Performance Foods that changed their name. So that's all kind of collaborative.
Good, thank you.
And proceed to the next one, upper left-hand corner. 7/27. 2026.
For Edge graphics, but
So Edge Graphics, is different things we do, right now, people can purchase, T-shirts for the parade. We do supply every new hire with 2 uniforms, as a retention. We get a lot of our supplies through, we like to keep it in county. That we get, even for the CNA week, where we might be ordering months or to reward them and thank them for being part of our team, different things like that. Each people have, and make each other. Any other questions on the 7/27?
really familiar for.
That's actually a housekeeping cleaning solutions. Or with the SDS reports, there's only certain ones we can use.
Any other questions? If not, and I have a motion to approve the expenditures of both the 15th and the 27th.
I'll make a motion to approve the expense vouchers for both dates. Like,
Jennifer? Any other questions? If not, all those in favor say aye. All opposed, say nay. Carried.
Thank you.
Next is the discussion possible action on presentation of the 2025 audited financials.
So I'm hoping you all got your email that I sent out, I think it was last week. That included all of our audit documents for both the healthcare center. And then there's a separate audit document for the farm. I just want to go through those a little bit, talk about the audit. Point out some highlights to you, that were brought up. This is the 2025 final audit. I'll start with the healthcare center, the management letter. I believe that was one of the attachments entitled Trumpealeau County Healthcare Center Management Letter. I'm not specifically going to go through this. It's pretty straightforward. If you want to review that, on your own, or if you haven't already. What I would like to focus on a little bit more is the document in your email that's entitled County Healthcare Center 125 audit financials. That document should have a front page similar to this. This is we call it the yellow book. This is our actual audit. This combines all of our facilities together. So as we start this document, there's a letter to the Board of Trustees explaining their responsibilities for the audit, our responsibilities for the audit, and kind of gives an overview, a snapshot of how the audit went. The audit went very, very well for 2025. There's no really glaring differences in the audit this year as far as the numbers for the facilities compared to last year. I'll take you to page 5, which begins the statements of net position. This is your typically called a balance sheet. This lists all of our assets for us. It starts out listing our cash balance, which you will see at a little over 9 million as of December 2025. And then you'll see the column next to it that kind of compares all the numbers to the previous year. Just below that is our non-current assets. I just wanted to make a note to you, the restricted assets cash. I just want to note to you that this does include our debt reserve accounts for Pigeon Falls and Willow bonds. This includes housing and urban development money, which is for our Arcadia property, which is a HUD property. And we have some security deposit funds that are held for that property. So that is what is in that restricted cash balance of $141,000. So then you will go down a little bit further. You'll see the capital assets. Of course, this is all of our land, our buildings, fixed equipment, movable equipment, vehicles. So our total assets, I just want to make a note too, a little bit further down, is deferred outflows of resources. For those that are new on the board, this is WRS entries that we are now required to make because we do participate in the state retirement plan. So the state sends the county as a whole numbers of these numbers that we are required, the county is required to report on their financial, and then the county auditors pull out our numbers from those numbers, and those are the numbers that we are required to report on our financial. It's not a tangible number that I can tell you that we hold or anything. It's actuarial numbers, but those all come from the state. And that's basically because of that retirement program. There's assets and liabilities with being a participant in that program. So our total assets as of December, we're sitting at $43,500,000. The next page, we'll go into the liabilities, page 6. There's really nothing to note here. Anything different from last year. I'll note the long-term liability about a third of the way down, net pension liability. That again is WRS entries. That's a liability that we are holding for our employees that are in that state retirement program.
Pause for just a second for a question, a couple questions. I'm new to some of this, so some of this I'm not, but when it says that now I lost my train of thought. The pension liability, I guess just explain to me with the Wisconsin State Retirement, does the organization contribute dollars to that, right?
Right, so because we participate in that program, employees are responsible for, they have a portion of their check, each paycheck that is pay towards their retirement, and then us as the healthcare center have to match.
You match it. It's like a 401k type of
Right.
scenario.
Right,
And it's to the employee, it's optional how much they
no, the
don't.
state
No,
sets.
the state, no, I'll go ahead.
That's usually.
The state sets every year what that percentage of their wages has to go into that program.
And what is that then currently?
It changes every year.
It's 7.2.
Is
Yes,
that up to
for
7?
26, yeah,
Yeah.
it fluctuates,
Yeah.
but it's always been around.
7.25, I believe.
What's the percent match the organization does? then?
Exactly.
It's the same.
So
It's
it's
50-50.
And then it's a requirement of the state to have a full
It's a
100%
requirement
match?
of employers when we participate in the state program.
Okay, that's helpful.
Okay.
Oh, bonds, that was my other question. For some reason, I had it in my head that the healthcare center was bond free.
I will talk about that.
Okay,
I'll point that out to you. No, we are not bond free.
I see that.
But I will talk more about that on a different page, if that's okay.
Yeah, that's fine. I don't know why I had that impression.
Okay. If there are no other questions, then I will move on to the net position, which is near the bottom. I don't remember who it was, but there was a question at one time about fund balance. If we hold a fund balance, was that you, Richard?
I think.
Might have been. So because we are an enterprise of the county, like the fund balance is very much a municipal county item on their balance sheet. For us, as an enterprise of the county, we have a separate financial from the county. So our financials require us not to so much define a fund balance as it is to define a net position. So as we go down here, when you look at net position, just below it, net investment in capital assets, that's all of our buildings, our land, less our debt and depreciation. Then the restricted ones, that's our HUD money, is a restricted net position, and debt service is a restricted net position. Those are net positions that cannot change, other than those two entities are the only ones that can change that net position. That's why it's listed as restricted. The unrestricted, that's our fund balance, if you will. This is the amount in that account that we basically have for our total operations. Our fund balance.
And that was as of year end.
As of 2025. Then our total net position, then you'll see, is sitting at a balance of 14,120,000. Which is an $89,000, little over $89,000 difference from the previous year, right next to it. That's basically our profit for the organization in 2025. Okay, so it's listed a little bit differently on this particular financial, but that's what those numbers mean. It's that net position is our fund balance. Okay. So then you will see that our liabilities sitting at 43.5 million do match our assets, so our balance sheet is balanced for 25. So then if we move on to page 7, this is our statement of revenues, expenses, and changes in net position. This is our income statement for 2025. You'll see our operating revenue. Resident services is all of those services that are billed for the residents that are staying here. That sat at a balance as of December of 26,546,000. Other listed right under there is various different revenues that we bring in: transportation, beauty shop, canteen, different psych billings that we do, and medical services type of billing. So that's what the $976,000 number is. And then the remainder of the document is expenses. These are line items below here, very similar to a cost report that we're required to submit as well. Nursing services, other professionals, such things like that. And then our operating income as of December sat at $821,000. Then we have non-operating income and expenses listed below that. You'll see our change in net position for 2025 was $89,429, which matches to our balance sheet as the net income for 2025. So we are balanced.
Why is the non-operating income a negative?
If it's a negative, then it's an expense. So it's an offset to income. So interest expense is not income. It's an expense, so it's a negative.
Right.
Interest income is a plus, so that's not a negative. So it's a plus minus type of reporting in that section.
Got it.
Okay. Then the next page, we'll move into cash flows. So this is the report that will give you a good breakdown of exactly where all of our cash was spent. Going down about a third of the way, net cash provided by operating activities. That's how much cash, well, I'll move up a bit. Cash received from residents is all of our resident revenue, 27 million. And then cash paid out to expenses to employees, cash paid out to suppliers. So this gives you a really good detail on what was spent for cash for the year. So then net cash provided by operating activities was a little over 2 million. I do also want to point out to you about halfway down, cash flows from capital and related financing activities. So this is all of our bonds cash flow. This is our leases cash flows, and our matrix, which is our resident software for all of our clinical. That's in here. I want to point out the first 3 lines. You'll notice that there is no number for 25, but there were numbers for 24. And the reason for that is we refinanced this building's loan in 2024. For those of you that have been with us on the board for a bit, you'll recall that. So that's why there's a difference there. This is money that was only moved in 24. It was not moved in 25 because that refinance was in 24. So I wanted to point that out. That was a little bit, that's a big change. So then our cash at end, which you'll see at the bottom of page 8, a little over 9 million, that balances to our cash balance on the balance sheet. Then I will take you to page 10, which begins the notes. I'm not going to go through everything on here, but I do really recommend that you read through these. It gives a really good information on the healthcare center, how our finances are done throughout the year, what we are required to do throughout the year, all the different entities that we report to. I do want to note on page 10, note 1, where it does list us as a separate operating entity accounting wise from Trempealeau County. That's why we're allowed to have these separate financials. And then just below that, it gives a definition of our fund accounting. Again, it lists that we're an enterprise fund for accounting from the county. So that explains the separate financials as well. What else I would like to point out, we can move to page 16. Cash and investments. I'd just like to make a comment here. You'll see it's noted at this note that our cash balance derived from operations of the center was held by Trempealeau County. So the courthouse holds our cash balance. We do not hold our cash here in this building. It's all held at the courthouse. The county is responsible for investing its aggregate cash balances, which they all do there. They invest those funds, all at the courthouse. We don't have any input into that.
So as far as your investment, you guys have no say in the, what they invest, that's,
The treasurer does it.
the treasurer does it all.
Who keeps an eye on the treasurer to make sure that? I'm just
Well-
asking, no, well, I'm just asking, to
So,
make sure that she's invested it wisely and, I mean, I hate to say this, but the treasurer's just, it's an elected spot, so they may
What's
not
the
have no
training,
finan,
right,
no
right.
financial background, and here you're taking all this money and giving it to them. Don't you think there should be a different way to handle that money? For
Oh,
them to be
there
wiser?
There is a policy that says how she can, I'm gonna say she because it's been
Yeah.
for how she can invest that money, and she's restricted to how that policy is.
But I think that's great, but what I'm saying is that, are you getting the most bang for your buck? Does she have nobody to advise her on what to invest in? I mean, do they invest in stocks, bonds? Or where do they put it?
When you
She
said
can't
executive
diversify.
finance, did you ever see anything where they're,
That showed our investments from the county.
There's documentation that showed us where bonds and things were held, things like that. I think that's I mean, that's a good question, Audie, because I think that we'll have a much better handle and oversight with the new financial manager that the county has, so then I'll stay on top of it. And to further your concern, Audie, it's more about, okay, is somebody watching to make sure that when financials need to be reviewed, that they're doing it in a timely manner, that it's not sitting there for a month and it's not making anything because it hasn't been renewed, and on and on. And so that would be a great concern, Rich, for you guys to discuss in
Yeah.
exec finance.
Yeah.
Yeah.
We used to,
And
at the exec, we used to get a report from because as county clerk, I'm talking kind of, the exec committee would get a report from the treasurer of saying where all the investments are, because, you know, you can only have so much money in a bank where it's still insured by FDIC and all that good stuff. And so I don't know if I've seen any of those.
So Chair, Rebecca, do you have any, for this committee, any insight of that monitoring that they're talking about? Do you know, is there anything out there we don't know, or is that kind of an exec finance research that needs to be completed?
Can you hear me?
Yes.
Yep.
I would say, oops, sorry, I'm getting a lot of feedback. Hold on. In the past, no, it's been the exec finance committee that, like you said, would get reports from the treasurer's office. That has not been happening. I think that a lot of that is reported in our audit, that there are definite areas of weakness reported in our audit that will be shared now tomorrow. And that's, again, as I've talked about previous, is the loss of institutional knowledge in 2 offices. And our CFO was watching basically over a lot of that, well, and our treasurer. But so anyway, I do think, to Supervisor Turner's point, we have a new CFO, but in a different place. But that is the purpose then, to have better oversight, and that we do start reporting on that. It's just that we needed to get as you all know, we need to get the system up first, but it's getting closer. So we will be getting back to that, and that will just be, rather than through the clerk's office. It'll be reported through the business office.
Thank you.
So then once those funds are reinvested or moved or whatever it might be, are you notified as to where and how much monies are at any given time?
Investments, invested amounts?
Yeah. So I think too, and that's part of that collaboration that we want to create and transparency all the way around is that once this financial system gets going and all of that is having some sort of way to report, whether it be twice a year, 4 times a year, whatever it is, to report back to the healthcare center executives. Where is the money? What is it making? How is it doing? So you're aware. I think another set of eyes seeing that is.
Well, there's 2 different components here. The investment, I can't speak to the investment side because we have always had an understanding with the county that we have not collected that interest money. That's the investment side.
Right.
The cash balance, we are to be getting reports from the courthouse on a monthly basis of what our cash balance is. And then we in the business department make sure that our cash balance matches that. Now, we have it through December of 2025 now, which was part of only because we had to have it for our audit. So that is a monthly process that we do with the courthouse to ensure that our cash balance is correct. And we're doing our entries are correct and their entries are correct. That I will share with you that I have not received any of those reports yet for 2026.
Nothing. So you would normally get those monthly and you haven't received them now for 8 months.
Right.
That is correct.
I think the exec finance tomorrow should really hit.
I don't know.
And then-
It's not on the agenda, we can't talk about it, we should.
But I wrote it down for the next meeting.
Yeah.
What is Rebecca trying to?
Yeah.
I was just gonna say that is correct, that, for whatever reason, again, I don't know, people went to this new system and then just decided that the system, I don't know, would magically happen, maybe, I don't know, but it just wasn't getting done. And so, I just talked to Pam about this, and we're through March right now. Stacy's working to help get some of that caught up as well. So we should have through June fairly soon. But anyway, you are correct that, and so all of that is being done to try to get it all caught up and done. And we just got the audit completed. And so with all of that cleanup, and now it's the 2026 and getting it all put in. And so that we're making good progress. That's all I can say right now. They're still working on it.
Becky, can you get them numbers through the end of March to Lori so at least they can take a look at it?
Oh, sure. I did ask that Pam would have that as a report for exec finance tomorrow. So it's not on the agenda, but you will have it as a report. So I'll ask Pam to just send that to Lori as well.
Is that going to be a quarterly or is it, because we used to do it monthly?
I would need it monthly.
Yeah. Lori would need it monthly, so
Until
Pam could do the monthly
Sure.
rather
Until
than
they get the
quarterly.
system running.
Yeah, I think
I
that's
know
the
getting
goal.
this new system going is taking a little longer than expected. Yeah.
Yeah.
Well, I think
But
it's a
it's
big
the way it
learning
is.
curve. So,
Yeah, I think it's almost like the question was twofold, was protect their money.
Yeah.
And protect, to get the most out of the bang that we can. And it's no cut on anybody.
Right.
It's just that you have people like managing money that maybe aren't used to that or something. Maybe we should just try to figure out a different way to do this. Not that we don't trust anybody, it's just that I think for everybody's safety and economic benefit, it'd be nice to have, or getting some advice from somebody.
Yep.
On how to invest.
Well, I think that's what Pam will do. Pam's
Yeah.
educated for
Right.
the the financial manager, or CFO, whatever you wanna call her.
Okay, so then I'll jump to page 20, because there was a question on the bonds, and so I want to be sure and talk that through with you. A little over halfway down where it says bonds, and then there's a colon there, you will see, or semicolon there, you will see just below there, there's three things listed there. The first one is 3% general obligation refunding bond. That is the bond that is on this building. That's the one that was refinanced in 2024. The second one, the 3% USDA rural development loan, that was for the remodeling of the old building. And then the 3.75 USDA rural development loan, this is the one that is a bond on the Pigeon Falls building. This one will be ending in 2020 or 2031. So we are nearing the end of that bond. Then we would just be down to the 2 bonds. So down below, a lot of people like to see this number, the very last line on page 20, our long-term portion, as of December, was sitting at just under $19 million on our bonds. So we're making really good progress on those.
The bond for the help for the Pigeon Falls was for the remodel.
Yes. And over 10 years, the bond for the main center was at 26 million, so that is now 16, so we've done really well in 10 years.
The next page then just gives the required payments on those bonds through 2045. The first column is the main building, and then the second column for direct borrowings is the Pigeon Falls and the old building bonds. So just want to point that out to you. Those are the payments we will be responsible for moving forward. And that, again, all comes out of our own operations. That isn't paid by the county at all. That's all of our own responsibility. The rest of the notes goes into the WRS system. You're very welcome to read through it. It's pretty intense reading and how they come up with those actuarial numbers. But if you have any questions at all, please do let me know. And if I don't know the answer, I will. I've got a lot of people I can get the answer from. So.
What you're gonna say, if I don't know, nobody knows.
Well, that's
Just a couple of questions. I know this is probably a stupid question, but I'm gonna ask it anyway. When I saw in the report various mentions of a pension plan, which appeared to be a separate thing from the retirement plan.
No,
Is that, it's the same thing, they just
It's the
use
same,
different
yeah,
terminology?
different.
That's what I
yeah.
assumed, but I wanted to be sure. And then on page 12, there's reference to multiple non-cancelable leases. I was curious what those leases are. What does that mean?
okay. Then I would, or page, I'll go to page 12 first. So this is a description of how they're reporting the leases. The actual leases that we hold are listed on page 19 at the top. We have 3. One is with Diversey, which is dish machines. One is with Loeffler Companies, which is the copier printer machines that we have. We have one here in this building and one at Pigeon and one in the old building. And the third lease that is reported on is Quadient, which is our postage machine. Those are the 3 leases that we have.
And those are all independent leases, so not like in a partnership with what the county has for separate leases with.
These
the
are
bank and
separate
stuff.
leases for our only equipment.
Okay. Okay, sorry. You wait for the next question, were you? No, I think I'm good.
Thank you. Page 31, I want to just point out related party transactions. These are the numbers that are assigned to us for services from the courthouse. This is court counsel, the clerk, the treasurer. So for 25, 53,000 was allocated to us. And for 24, 56,000 was allocated to us, so that has gone down. So that's basically built off of time spent from those different departments on our stuff here, because we are a separate financial, we're required to report that. It's not money.
31.
Oh, sorry, 31. It's not money, movement, but it is a requirement that we report it. This basically offsets that interest money.
And I can throw a little bit after the audits are done. The county has a separate auditor comes in and it's called the indirect cost study. And that's all the costs are put together and it's attributed to each department. So I mean, like if you had the county clerk's office does all this for all the different departments, well, then that audit shows how much was for healthcare center, how much was for land management, all this highway and all this. Same with the lights and the electricity and everything. The auditor does that and comes up with, well, it's called indirect costs anyway. And that's what this 53,000 then is saying, that what the county departments have done for other departments comes up to that amount of money.
Page 41, I just want to point out, I'm not going to go through this. This basically breaks out all of the numbers that we just went through by each of our facilities. So for instance, on page 40, it lists the nursing home is the first column, Pigeon Falls Nursing Home, and then WCWBH is the clinic, and so on. So if you ever want to take a look at how one facility is doing, this is where you would go to do that. And then I will take you to the very last, or I'm sorry, page 77. This is the letter to the board, where the auditor will list different internal control areas that they looked at during the audit. This is where you will find any material weaknesses or deficiencies that they have found in the audit. You will recall that in years past, we've always had one weakness where basically it was that, you know, the auditors completed the financials. They did some adjusting entries for us. And that was kind of a standard weakness that we had gotten, and it's kind of a standard weakness for many entities that are audited. However, for this year, at the bottom of page 77, the last sentence, you will see that for 2025, that they did not issue any material weaknesses or significant deficiencies to us. So I'm very
Very nice.
job.
I'm very pleased to report on that. Yeah, so that was,
Be very proud.
Yeah.
yes.
Good.
That was a surprise that we've made some good changes in our business department. Everybody's pushing numbers really hard, and so they're the ones that really deserve that.
I was excited to see that investment line.
Yeah, and you've created like redundancies and oversight of multiple operations, so
Yeah,
I
Looks
think
very
that fixed all that,
Yeah.
so kudos to you.
yes,
It
it's
looks
all
really
to my
good.
staff.
It does.
Good.
Yeah.
Kudos to you guys.
There
The
you
other
go.
document is the compliance audit. This is where you will go. It's basically all the same things. But you, at the end of this document, you will be able to see what counties spent money on us. So you will see a line for Trumpealeau County. You will see all the counties that gave us money in 2025. And what their revenues were and all of their expenses. So if you have any questions on that
How
one,
many
please.
counties do you contract with?
So it's kind of varies. It's a rolling number of 68 of 72 counties in the state.
We have
typically.
some now that have, their consortium may have separated, but now they're back together. So there's like two, like Forest and, the one right next door. They're collaborative, so it's called like a human service center that we contract, which includes those two counties. So, and it waxes and wanes every year.
Then the final is the farm. So this one's much simpler. This gives all the, all the same statements, the, statement of net position, the statement of revenue, which is the income statement. I'll point out near the bottom that the change in net position for the farm was $4,458. Let's see, I've got some other notes here. Just want to make sure I'm not missing something. I do want to point out in the operating revenue, you'll see the way at the top, you'll see the land rent revenue. That's actually the revenue from the rental of the land. Right below it, you'll see lease interest income. That's a little bit deceiving only because we do not charge interest on these farm leases. But according to accounting standards, we have to report an interest amount on the financial as present value for future monies that we will be earning off of that lease. So that's why that's on there. I just want to clarify that we are not charging interest. That's not an interest income, basically. It's just a requirement of accounting that we have that line item on there, and the auditors have targeted that 18,000 as potential future interest on that money. Again, cash is held by the by the courthouse for the farm.
What period of time with that lease interest income, what are they looking for? Time?
It would be the term of the lease. So the lease that we're in right now is 2025 through 2027.
Or 2 years?
Am I right?
3 years.
So they based that number off of 3 years present value cash of that for 26 and 27, basically, as of December of 25. Yeah, it's deceiving. I questioned that right away. I'm like, that's not right. You don't charge interest, but they assure me that's a requirement of the financial, so that's how we have to report it.
But then looking back at 24, that's only $1,463.
Well, that was the lease.
Oh,
rate,
yeah.
right? So,
And it would have been like the 3rd year of that.
Yeah.
right,
that lease.
Yeah.
exactly,
If there were 3 again, it was a 3-year.
right. And then, page 13 of the farm financial, again, the auditors felt that through the audit and our work throughout the year, this audit did not rise to listing that deficiency or weakness for this audit. So this particular audit has no deficiencies or weaknesses as well. Beautiful.
Good.
That's good.
Thank you.
That's a good thing.
Yep.
So, if nobody has any more questions, again, as you look at it more or go back to it or whatever, just please give me a call or shoot me an email, whatever, if you have any questions.
Make a motion to.
I just have one more thing.
Okay, go ahead.
I just want to mention, I have a few capital items here. You'll recall that we did approve the 2026 capital items list. I just want to give some updates on that because we do have some bids on those items. And so these are items that I would like to proceed with based off of that approved capital list, but I want to give you updates on them. Our first item is the final roof repair on the old building. This is the largest portion, and so this is one, I think we've been pushing this out for 5 or 6 years, doing different pieces of the roof. This is the largest one. But we would like to, get that completed this year. That bid, that updated bid with the company that has done that whole roof now is $105,985. So, just giving you an update on that, it's slightly higher than the number I had on my capital list at the beginning of the year.
When did you get that?
When?
It's the largest
July
portion.
30th.
Where they used to eat down
Yes.
below there?
Yep.
Actually, it's the worst part of the building
It
too,
is.
but it's the largest,
I
so.
think it's one of 5 areas. They were divided out into 5 different areas. So when this is done, it's done.
The second item, this is actually, a need for the nursing homes due to, maybe Joe, you can speak to this, and Jerry.
Yep, and so these are lifts as we look at patient care lifts. I've been very successful over the last 10 years. Rose applied for one too, so not just me, sorry, Rose.
Oh, that's okay.
With applying for grants for lifts and so forth. Joe has come to us, again, some of the patients we're taking, we're having more of the bariatric need and so forth for safety reasons. And the lifts that Joe needs for his, which then I, on the IMD, will get one of his for our clientele, are specifically individualized, different, and will meet the needs of the entire home. So Joe, do you want to explain what those lifts are a little bit?
Yeah, they're called Arjo lifts, and they're the best on the market. They have automatic tilting features, so that aides don't have to push and pull on the residents. It does it for them. It also has a feature where the lift will move itself, so they don't even have to push the lift, which has caused injuries in the past from, a lot of our CNAs are 16, 17 years old. They have a hard time pushing a larger patient in a lift, so these lifts actually will do a lot of the work for them. They're safer, safer for the patient.
How many are you looking to get?
And then you currently have 2 that will be deployed up into the IMD units.
Yep.
We have 2 bids. One is, from, is this an Arjo company?
Yeah, Arjo's the
Arjo,
company that
okay.
makes them.
That bid came in at $22,403. We did obtain a second bid, from Direct Supply for $24,081. These are really the only 2 suppliers that would have these lifts, that we're looking for. So we do just have the 2 bids, but we would be looking to, go with the Arjo company for the 22,403.
So just to,
Comparable.
just to back up a little bit, this isn't part of the audit. So we either have to adjust the agenda, because we don't have,
Well, part of it, I guess I told them that this would be the place on the agenda to do this update is what we're actually doing, is updating us on things that have been approved
We don't need
previously.
to vote on.
yeah, we're not
So-
voting on it then, right? You're just giving us straight up.
Giving you an update on
Because they were
things that
already
were on
approved
the
at the
list.
capital
Disregard them.
improvements.
Yeah.
Good question though.
So, what does Pigeon have then for, do they?
They have lists too, but we will be eventually going to these as we look at our budget and continue to budget to include more throughout our facilities.
So these are permanently installed into a specific room,
No,
or they're
mobile.
portable?
Yeah,
But they move themselves, it sounds like, they're motor.
Pretty much, yeah.
Yeah,
Electric
Yeah,
wheelchair.
that's pretty. that's
remote
pretty nice.
control.
Yeah,
We have a lot of, more than half of our patients are 2-person lifts. These actually can be operated by 1 person.
huge.
There's a ton of benefits, for our staff.
And I think that's important because I remember when I was at the highway department, when the insurance people would come in, they say, this is the place where most of the, I got claims came out of.
I was,
So if you
Yeah.
spend $22,000 and save a $70,000 claim, yeah, I think it's money ahead.
it is. Is there any benefit on the insurance side for decreasing rates with that equipment? Probably not,
I
but
think that's a good. That's a good.
I mean, you know.
Less expenses.
Yes, less instances, but you know how it is. Sometimes you can negotiate.
So the
Yeah,
two
no,
prices that you have, was there any difference in service with that, or is it just a straight up excuse me, even Steven?
The better part of going through Arjo is they're the ones that come out and train anyway. So if we buy it through them, that'll be included in the price. If we go with like a direct supply, we probably have to contract for Arjo to come in and special training for their staff, so. They're cheaper and we'll get better service.
Yeah.
Training, so.
I'm good with that. I am curious, what is the nursing home census? What's your total, not current census?
We're 34
capacity,
beds.
34. And Pigeon is what?
37.
37.
So do you see any future needs or immediately needs up there?
Not immediate, but definitely.
Yeah.
Future needs.
And then I think, did you have one more thing?
I have, the, an upgrade in Pigeon for handrails. This has been on our capital list. It was on our capital list at the beginning of the year. I want to give an update on that. The total material cost is coming in at about $27,000 for material. But this is all the handrails and
And
the,
board behind
what do
it.
The
you call
board
the,
behind it.
yeah,
Throughout the whole
Yeah.
facility?
yeah.
So it's cleanable, it's more attractive. Getting away from the nicks with the sheetrock and stuff, it's gonna be aesthetically make it look very nice and it's been long overdue.
And then the labor cost on that is just under 32,000, so I wanna give an update on that.
And what was the number that we assigned to the capital for that?
I don't-
How many did you get?
I might have it with me too.
I know the labor stayed the same. I think the material maybe went up $500.
Okay.
But we've had that bid that's kind of been on the list for a while.
Wow.
So.
And our
it-
guys-
It'll change or go up a little bit.
This bid was just obtained August, yesterday.
Oh, okay.
So,
That's
no,
good then.
today, actually, this morning.
And
So,
our guys were going to do it, but other projects, it's a specialty company that comes into nursing homes and does this on a regular basis.
Do we get multiple bids for the work or no?
this is the only company that.
This is the only company that actually does this specialty for nursing homes.
And where are they gonna be placed?
So if they're going down the hallway, because some of our handrails, we have to sand off because of splinters and stuff. So you have a handrail on the wall and then coming up, I think it's 3 feet, isn't it, Joe?
Yeah.
3 feet, there's gonna be a board behind that. That will be cleanable, aesthetically looking nicely. So the board will go in first and then the handrail will go over there. And they will go from all the way to the floor, just above the handrails.
Well, it's all like a PVC vinyl material, so it's cleanable, infection controls, but it's better. Wood is just not conducive to.
I have, wallpaper underneath the handrail right now. that I
Yeah,
dig
right.
up.
And the state is making strong recommendations that all facilities get on board with this.
It's better for wheelchairs.
Oh.
It's like a wheelchair
Oh, yeah.
bumper too, so
Definitely.
it's win-win.
They get picked up so bad
Oh, they get
now.
picked
but
up.
with
They said
the
the money
material,
that
they would get
recommendation.
picked up.
Yeah, I know. That was one of those state deals.
Okay,
I
and
have
then next,
a plow truck.
okay, we got one more yet here. Oh, two more, I'm sorry, two
A
more.
plow truck, this was on the list, the capital list, the estimate we had on that list, I know for a fact was at 70,000. This vehicle is actually coming in at 52,600. And then again, this is gonna be used for plowing. Correct me if I'm wrong. And, so he's got plow cost on here, and other items on here that will still keep us below that 70,000. So, I'm giving an update on that. That actually is going to come in cheaper.
What do you do with the old truck? You sell it, put it on.
We'll put it on the byline.
So does that plow truck get used here and at Pigeon?
Yep,
And at all of the other
all
locations
locations.
as well?
The last item, there is a area for cement needed for a recycling building down here. This is an area that is currently gravel that dumpsters and recycling material sit on. It's a 48-yard pour. He's got information on here to be sure that it will take the weight of the items that are on there. So it would be just material because our maintenance will do the labor on that for $10,203.
Where is that coming from?
Our budget.
No, I'm sorry.
Oh, I'm sorry.
Concrete, who do we have? Who's
Independence.
bid on it?
Yeah.
Just for thought. And I like to support the local communities. But they should check around a little bit. Somebody should get knock off 20, 40 bucks a yard. I mean, it doesn't hurt to ask.
They do ask, I don't know,
Yeah.
exactly
do
which
their-
ones they're doing, but.
It's around $200 a yard, which today is not bad.
That's what they should. Yeah.
I did think that there was some policy that when you're looking to do capital work, you had to get multiple bids from places.
So, yes, that's our procurement policy. The roofing one, they've already been. Arjo and Direct Supply, I got 2 bids from them. They're the only 2 that carry that. Inpro is the company that does this for nursing homes.
Which we tried getting additional ones, and the only other option we had was for our maintenance to do the work, we just ordered the supplies. But still by code, it needs to be specially installed. To decrease that liability and risk, because if our guys install that and there's an error, a fall, especially with things, we have to decrease that liability.
Yeah,
Yeah, they're all popped
So
up.
anyway, you
Yes.
advertised for these bids and only one came in. What else can you do but just,
I guess that's
Either
what I'm
one,
asking.
yeah.
Should we advertise for all of the bids that were?
Nathan, our maintenance director, obtains all of our bids.
Yeah.
So you don't like
So-
put it in the paper like the county does looking for a bid. You just reach out for bids.
We reach out for bids.
So Paul, when you're saying it's published, it's not that. I don't know if it has.
That's not
I don't know if that's.
We
Well-
seek the bid, we announce,
yeah, you actually announced that you're open for bids or whatever.
Yeah.
So that probably is in the paper or it's on Byline or something or out on,
It's on the paper, we use our vendors, we look out to other things. With our procurement policy, even with the lists and even with the emergency needs, and that's what's a little different out here. Is all of a sudden I might need a $30,000 expense for emergency needs, is we have to go to our vendors that have that we know that have that, because we need to prep. But even like a lot of our other contracts and so forth are put out for bids. But when it comes to the service supplies, it depends on what it is, to be honest.
Right.
Yeah, it really depends on what it is, because if there's something, out of the ordinary, then that would go out for bids.
Like the lifts is a good example, it's like the companies that can even legally sell
Right. I understand the lens.
it. Very after bad, there's certain.
They're specialized. You can't, there's not like 6 vendors out there trying to sell it, so. We ran into that a lot of times in the city where
Even with
you
the
were
vehicles.
supposed to procure 3 bids. But if there's no way to get 3 people that can bid it.
Yeah.
So at least
As long
you
as you
tried.
put it out
Yeah,
there.
and
That's
then
good.
so you tried.
you've gone out,
Yeah.
yes.
And then there's a dollar amount as well. Yeah, I heard you. Audie, that was you.
And our procurement policy, the courthouse didn't have one, so we shared ours with them, which helped guide the courthouse for our procurement policy, which has worked out very well.
I was just mostly curious because I'm surprised that there's literally one company that does the handrails. Like that seems like quite the monopoly and there's a lot of facilities that have those. So like there must be something different about the product you guys are looking to get.
Must be.
You need them anyway. I don't really care, but it's just like, there's gotta be other people that do them, but
And part of it too is that it was the timeliness, and I know when our maintenance director talked with even, just private construction agencies and so forth, the timeliness comes into play too, because it's more of an emergent need, especially when we have the state recommending. We told you to get this done.
Yep.
So get it done. You get it.
Yep.
As opposed to 10 minutes.
I'm going to be turning the meeting over to Bridget because I'm gonna have to take off. But,
See you tomorrow, Paul.
yeah, I'll be back
Was
tomorrow.
there any more updates on anything else?
No, but I do need a motion to approve the audit.
Right, right.
And she did make the
And-
motion, then we stopped the meeting.
I'll make a motion to approve the 2025 audited financials.
I'll second it.
Okay, a motion by myself, seconded by Dawn. All in favor to approve the audited financials, say aye. Aye. Those opposed, same sign. All right, that carries. Next, we have the Department of Health Services survey update. Joe and Jerry.
Go ahead, Joe, you can start.
So in June, we had a resident pass away, and reasons I won't get into, we knew the family member was gonna file a complaint with the state. She filed two separate complaints. One was, felt that the family member was malnourished. Should have been on the food feeding. And then the other complaint was she had requested the full medical records. And she is not qualified to receive those, so we told her that, and we told her how a family member could qualify to get those records. So long story short, a surveyor came in on July 1st and did a thorough chart review, talked to the physician, staff members, and she found that everything was done very well, with no concerns. And with the release of the record, she also agreed with how we handled that, so there was no deficiencies. And I know you guys had asked once, so we keep all of our survey records up front, at the front desk, there's a book up there. But when we have something like this,
Hold on.
you just get a one-page sheet like this. It's called an SOD, Statement of Deficiencies. And it just basically says, during this complaint survey conducted on 7/1, Trumbull County Healthcare Center was in compliance with blah, blah, blah requirements for long-term care, so.
But your last full survey is out in a book at the front desk.
Yeah,
And ours is in dining room.
and that was March of this year, was our last full survey, so, yeah.
You know, if you try to go out online and look at anybody's star ratings or any of that stuff, it's.
You could look anybody up.
Old, you're kind of-
Yeah, there's
It's not
almost
current.
too much.
Any nursing home, you can look them up and see, I think it's
Yeah, but
5 years.
it's so old though, a lot of it.
Well, and what's happening, especially over the last 2 years, is that there's even some 1-star, 2-star, because there was a big CMS concern with data going back and forth, that some facilities got like a 1 and 2 star when actually they're a 4 and 5 star.
Yeah, and I can't believe that they haven't been able, or haven't really corrected that, that's.
The other piece right now is they changed the quality measures, so now the bar is higher to reach the higher star level, so everybody was getting better, so now they raised the bar.
Yeah.
And-
Any questions?
And for the IMD, for the IMD, I had a state surveyor walk in yesterday on a complaint. And it was regarding a resident had concerns about phone access, phone restrictions, resident rights. And again, like we do with all staff concerns that are totally investigated, resident concerns totally investigated. We have reports on every single thing because the state just shows up. We have to, within an hour, we have to have this information in their hands. So it's very thorough. Even Joe's investigation, which, multiple people review it and critique it. So yesterday, there was an individual that felt that her rights were being violated. There was no citations whatsoever. This individual actually, by the courts, has restrictions and by the courts has an approved list that this person can only call with supervision because of multiple reasons. And supervised visits, and these are the clientele we have here. This person, it was the first time he put under a civil legal commitment. And again, we process through this stuff with a therapist, with a treatment team, that your chosen behaviors outside of the organization is what dictated the courts and the plan of care. So everything was to a T, the plan of care, many client interviews, many record reviews, looked at any complaints that I have had since the last time they were in the building. And there was no recommendations, and very complimentary on all investigations, and no concerns identified, and they left.
Love those.
Yeah.
I know.
All right. Anything else, Joel or Jerry, on that? Any questions for them? Okay. At this point, I am gonna close the public comment period. Thank you, Audie. Then we have the Trumpealeau County Healthcare Center's IMD 10-year journey on the road to recovery.
Who's doing that?
It says you, Jerry.
Gosh. And if you do want to take one, pass it around, just if you want to look at a reference to follow through. Otherwise, Josh is going to be so kind to get it up here.
Is this the same document we got when we were in our packets when we first?
Nope, this is a section one. So just a little history here. And it was presented by our architect and Terry Summer, one of our retired administrators, and myself. And I've been working on this for a decade now. And Trempealeau County Healthcare Center operations here are.
I need a second.
Okay.
When I start the slideshow, it hides my, what screen do you want to share?
Did I leave another document?
This, the one that says special service revenue.
Oh, no, that's in there. It was about the tone, the National Tone Award. Did I leave that in your files?
I didn't see it.
Okay,
On the email?
nope, I'll go off the top of my head.
You think it got included in what got passed around?
Yeah,
Oh.
Okay,
no, that's okay. So before, well, Josh gets set up here, what's been going on is that when we went into this building, we submitted a lot of data to try to improve, see how we can improve through our quality improvement committee and so forth on treatment and recovery for individuals. With that being said, we have transitioned into a stabilization facility, recovery facility where people aren't here for, percentage of the population is not here for long term. Our average length of stay is usually about 70 days, which has come down significantly throughout the years.
Is that specific to IMD length of stay?
I
Not
feel
nursing
like
home,
it's
right?
not nursing. This is specifically for dying.
Okay.
A state-only facility. As you saw in the previous presentation, we made a lot of good strides, and we've even went further. Part of our Department of Care and Treatment service contract and grant that I apply for every year, and I'm the grantee individual that signs the contract for the $1.55 million grant. This data is also shared with them because we need to have a performance plan. We do have a performance plan that I have to submit every 6 months to the state of Wisconsin in order to keep this grant. There's a lot of criteria on there that if I don't ensure the treatment team adheres to the plan, we can lose that. Now, that money does not, portion of that money goes directly back to the counties where they get a discount per day for using us in this facility. So it's a collaboration with the state of Wisconsin, and it works very well. So I was asked to do a further presentation for this National Tone Award, which is an award that identifies exemplary care for facilities. This is a national award that we're participating in. We are in the top 2 finalists, which will be awarded in this March of 2027. So part of this presentation was to do a recap over the last 10 years, where we were, where we're at, where we're going. It's quite a stepping stone for the entire to be on the radar for the nation, for the state, as we serve all of Wisconsin, and for Trempealeau County. Trempealeau County, you know, we continue to build very, very good relationships across the state. Even when things get kind of tenuous, I'm at the table. It's not about dictating, it's about partnering to ensure we're meeting the needs of these counties that pay our bills. As we know, we don't take tax levy dollars, and they come in through contracts through the counties themselves. So the architectural company and myself worked with an agency based out of Pennsylvania, and others were throughout different states throughout the US. So the presenters in this were the only one in the US was Trempealeau County Healthcare Center. The other presenter was in Canada. The other presenter was in the UK. And the other presenter was from South Korea. So I'm taking a lot of value, and you know, again, it's not me, it's not just me, but you know, David and I, we pulled all of this together. Lori with the financials, thank you, pulled all this together, but truly it's a treatment team concept here. And I just happen to be the one at the table presenting the data and looking at our past, our current status, and our future. Again, we want to be known as, you know, a state-wide regional service that we provide to everyone. The dialogue I had with a lot of these individuals, we are far ahead of many countries. This here, there was over 40, oh Joe, what was it? Over 40 that logged in. There was over 1,200 people that logged in for this presentation, and it was nationwide. So it was, you know, it's the largest that I've done, and I was pretty impressed. They kept us on a very tight, you know, 5 minutes here, 10 minutes here, and so forth. I could elaborate on this for 2 hours. I will not do that.
Thank you, Jerry.
I will, you know, as we go through the slides, a lot of this you guys have already talked about, but I will do my abbreviated. And if you have questions, please feel free. It is out there recorded on YouTube somewheres of what we did for the entire nation. So it's quite nice. So person first design. Trempealeau County's 10-year journey on the road to dignity and respect. And again, our previous one was road to recovery, but it went a step further. Step further is dignity and respect. It could be any one of us that might need inpatient treatment at some point of our life where we might need supports, we might need tune-ups. And we strive for individualized plans of care, which means we involve, number one, the individual. And we involve the family if it's therapeutic. And also the counties that pay the bills and the treatment team themselves. Let's go to the next one, Josh. There, I'm gonna kind of go through a little bit of history here. Of course, we know back in the late 1800s and 1900s, they chose to develop a series of county hospitals and 2 state hospitals. In 1898, Trumbull County officials made a decision to build the county assailant or farm at that time.
That was a cool building.
And when I first started here back in 1987, I was one of them during the night shift, as I was a CNA at the time, and I worked every position in this building. And I used to have a watchman's clock on my side with a leather strap. You put a cardboard piece of paper in there. You would have to go to these stations throughout the building and all the buildings on the grounds. Put your skeleton key in there and you would turn it twice and that would mark when you were there. So we made sure that we were safety wise observing to see if there's fires and different things like that. Wonderful building, as you can see on the far right. It was Ward A, far left is Ward B. In those days, segregation was a big thing. Men were on the right, women were on the left. Where now we've progressed to commingling. Pretty impressive. We employ about 270 individuals. Each department with the organization contributes to the elevated level of specialized care offered to those at Trumbull County Health Care Center. Our goal, no matter what the setting, it is specialized plans of care that maximize living life to its fullest. Again, it's not about me. And I tell staff, it's not about you. It's about the individuals and how do we recover individuals and meet the needs on the spectrum of life from 18-year-olds all the way to 100-year-olds for other organizations. Back in 1994, of course, I was working as an RN here, and I had my predecessor and the previous predecessor, Phil Morrison. I was very fortunate to work side by side with him as an RN, and I was part of the process with the state when there was a decertification in 1994, I believe, that the feds in the state came in and said, we would have had to issue you approximately 40 citations for resident rights because the population we serve were of the high risk aggression, property destruction, suicidality, which when individuals say, well, it's different from the 1800s, 1900s than it is now, actually it's not. You know, the intensity's actually grown because back in those days, we had to decertify federally for this side of the building in order to meet the need for the mental health, suicide precautions and so forth. If someone's highly suicidal, you don't give them bed sheets. So all of that was established. Again, what did that do with the facility? It created the facility to become a state licensed only facility. We're still licensed under the HFS 132. The state regulates us, but it took the federal funding away. So then Phil, brilliant in his era, worked a mechanism for each individual county where we actually developed contracts with individual counties because they can receive the MA dollars to their county and then they can pay the bills here for the state. But we couldn't continue to operate with that federal oversight. Otherwise, we would have had to transition to a traditional nursing home. And the mental health component was so important for all of us and for the organizations to continue that philosophy. So that all happened and so forth. Let's go to the next slide. Okay, so as you can look here, we have the more of the, it was the old building. This is more of a contemporary medical model building that later on, as the acuity further came to the table with individuals that we're getting. We're no longer getting individuals for recovery that just have certain struggles. They're so medically and behavioral and complex, dually diagnosed, that this building was actually wearing out to meet that state of the art of mental health services that we now provide. As Trempealeau County Healthcare Center, IMDs become more of a subacute and acute facility, where we are getting individuals directly from hospitals, state hospitals, jails, and so forth. Yes, Doc.
I'm just curious, is that building on top of where the original building
Nope,
was?
the original is behind it. So there's a tunnel that we would always have to go underneath to that old building. And then there was a tunnel that connected it, and then they had to walk across that back. And when
Still there?
yes. And as you go out today, please look to the left of the hallway, that it has the stages of all of our remodels there, which is quite fascinating, because it is part of Trempealeau County. It's part of Trempealeau County, and we're just very proud. Again, we treat individuals with schizophrenia, bipolar, post-traumatic stress disorder, borderline personality disorder, alcohol and drug substance, and multiple other individuals that we treat. These are some pictures of our old contemporary building, medical model, or the next slide, Josh. Let's look at some key metrics here. Any questions about the history? Again, when we did that, we definitely looked at following staff, working on the units, trying to get what things would improve staffing, improve visibility, improve staff accessible for emergency needs and so forth. And these metrics are everything that, really set a motion for us to move quickly on this building. Here in 2016, you can see our number of admissions, number of discharges, average length of stay. Sometimes we do have people here that are here for 2 or 3 years. We try to reintegrate them back in their community, in their home county, and they end up coming back and coming back. So then we take the approach, let's reintegrate them into one of our homes to prove to their counties that I'm okay. And we still have those struggles. There's some counties that just cannot find places in their counties for these individuals. Seclusion events, look at that number. I know that when we moved into this facility with the design and stuff we had in our previous conversations, our previous presentation, just moving and using individual rooms, revamping our programs for de-escalation went down 34% within the last year. It was just amazing. Peer altercations. This, I'm not going to go through all of the details here. There's a lot of categories, a lot of graphics. If you look and study the highlighted, when you go left to right, you look at staff workflow, you look at space. So what we did with all of these numbers, interviewing staff, observing staff, participating on the units, even the architects would come in and be with us and look at how we can be more efficient. Again, going into our old building to this building, there's only one key position that we added. Otherwise, it was a staff neutral cost, was because of when I used to work here back in the day, and it was a lot more beds, I was the only night nurse for the entire building, and it was multiple levels. Where now, that's one example, that's where we added a position, is that it's so spread out between the 2 licensures, which was purposely designed to give more space between the 2 licensures, that we hired a individual night nurse for the nursing home section and then one for this side. So that's the only position that we added. This is really an interesting slide, and if you want more details, I have my slides here, but I'm just going to talk. But you know, we all know this stuff, but when we were going through the design, and this was a very important factor for myself and the treatment team, is how do we gear where we place individuals based on safety, okay? So you can see they use the terminology maximum security. I use high risk versus maximum. I want to keep it away from the jail terminology. Thank you. And most of our people come in very, very acute, very, very sick. And we align them right with our, we call that our dignity unit where it says maximum security. Now, our pre-admissions, we pretty much 90% of the time know where individuals should go. Example, I recently, admitted, wrote up a policy and procedure with Dr. Persing and our DUN on admitting voluntary residents, so we trialed that. Again, they went to our least restrictive unit. So every single person, and it depends when they come from the state hospitals, some of them cannot even have binders, they cannot have pens, they cannot have binders with metal because they will swallow it. They cannot have their own toothbrushes in their rooms because they will swallow, or they will cut. And again, in my 39 plus years, I see it all, but there's still things that I'm like, wow. So we need to develop programs and so forth. So our high risk is straight ahead on the bottom of the page, dignity. Our medium risk is to the left. Our minimum risk is to the right. Again, the maximum and the medium are special even for design. So their design have windows that are break proof. When they go to minimum security, it is a window that can be broken, but not, it'll shatter, but not break. So there's no shards. And our IMD Gerald site, they're directly across from the main entrance. Entrance is more of a Gerald site facility. When we built this, in case census went downhill, we have the capability of licensing that as a CBRF. So there's always backups.
Geriatric.
Oh, geriatric site.
Is the geriatric psych unit, is that counted in the total number of nursing beds that you gave?
No,
34?
No, that's under the IMD as well.
So that's part of the IMD, is the geriatric.
Yep. And we actually made on the far right, we call it our XL unit, the minimum security, we actually made to another geriatric capable wing because we're trying to meet the needs of the managed care organizations. Because within the waivers through the state, a managed care can pay for an individual on our IMD if they're under 25 and over 64. If they meet the criteria for mental health and a locked unit. So there are those caveats in there that we work with every single day for funding reasons. This is another slide of the design, the front of the building. You can see where it's located from the old building. Again, the old building was kept up. That's why you see bond number 2 in our audit reports that the board opted to remodel versus tear down. And we made that into the CBRF's and office in both and business office.
Very
Go ahead.
And the one before this.
Yep.
Do the patients, can they just walk around where they want, pretty much?
Depends.
I mean, the maximum security, I know they can't.
But even on the other ones, they are, so all.
Like the nursing home, can they go to that minimum security if they are?
Nope. Well, all of the IMD units are secure. And the reason they're secure is because. It's separately. They're all separate, they're all secured, and they all are placed here under court orders through the judge. Now, our recovery program does empower them to make appropriate decisions, go through our treatment program, and based on safety and adherence to their individual plan of care, which is set up by the patient and the county and the courts, they earn time off the unit independently, even outside independently, which is gearing them up to reintegrate to the community. So if someone's spending their free time out in the main lobby and they decide to run away, then they made a bad choice, and we work back through that with our safety management program. And when I was here back in the 80s and 90s, that program was 10 tiered, 10 levels, and now it's down to 4. And we've become very, very creative and individualized. So we do have significant others that the counties will direct to start them on separate units until they are mentally stable to the point where they can safely live together on the same unit. So we make all kinds of accommodations. It's
Yeah,
pretty-
you don't have near the escape visas you used to.
No.
Thank God.
I think, Jerry, I think I heard you say that in the old building, you have a CBRF.
We have one there now,
There, how many beds is the CBRF in that?
15. It has to be under 16 to have the MCO funding.
What is that one called?
We have Willowbrook and Willow Ridge, and then we also have a CBRF in Independence, Farnham House.
Well, yeah, I knew about the
Yep.
ones offsite. I just didn't realize that there was a CBRF within that building.
Yep. 2 separate ones.
Okay. Two at 16 or 16 total?
2 of, so it's a total of 30 under 16 beds. And even with the IND, just a little history here. Back in the day, we were one of 6 across the state. Now we are 1. And then there's 3 other under 16 bed facilities that are IMD-like facilities. So they've closed. Again, there's been a lot of financial troubles within those counties. And the county has opted to close them because there's just not the funding there, and Trumbull County is the only one left. That's,
Specifically IMD CBRFs.
yep,
CBRs, just
IMD here.
Oh, here, you're talking
Yep.
about here again.
This was a really helpful tool for me, for us to use, as you can look at, if you look at the FAR document, lower left, which the definitions are on the right. That's all part of our data collection, decision-making, planning and function, where we had to actually meet as a team, every single individual involving the practitioner, where should people be placed to meet that safety need and also to meet that therapeutic program. Some new pictures of our building, when you talk about service lines and realization, you know. Off the top of my head here. So when we talk about service lines, this is an example, go to the next slide. So when we talk about service lines, these are on our most secure, the FAR 2 on the left are our most secure units. All of the 3 secure units. What that does is that it brings the service to them. So we are able to keep our high-risk individuals secure. Some units have to use plastic silverware or cardboard utensil of such because of challenges and so forth. But in the old building, we used to take everyone down to the first floor dining area that you talked about earlier. And it was more of an assembly line. You had more disagreements, you had more arguments, you had more peer-to-peer altercations, elopements that wasn't secure. Even though we had the staff to monitor, it just was not therapeutic. It was more of a lunchroom. It was more of a general population where we're all just gonna go eat today, where you couldn't individualize the plans of care, you couldn't individualize the diets. If someone has a functional maintenance plan where they need to definitely have someone by them to assist them with eating appropriately, it was really hard to establish that criteria there. So here, everything's self-sufficient. We will cook in these, the main entrees brought in. The far right is in the nursing home where Joe resides, the administrator. Joe oversees.
I have a different term for it.
And you can see that open concept where they cook a lot of their meals right there, which, you know, the smells and the flavors will stimulate the appetites and stuff like that. The far right is also part of our geriatric site unit, Birch. We have that same concept there because of the population. Staffing, efficiency, safety. We're seeing a lot of great satisfactions. These are some additional that enhanced our program, especially when we look at trauma, we look at individual mental health, education, treatment, individual counseling, our mindfulness groups, in the whole array of mental health and specialties. We're able to have the space and the individual private settings where we can actually educate. And we have clients that reside here that will educate each other, and they will partner with us in that treatment plan. So they will get up in front of the room and so forth. It's beautiful. As you can see, the lower right corner, that is our most secure unit bedroom. You can see can't quite see the door, but all of our doors on this side of the building have anti-ligature for suicide prevention, where it is slanted. So if someone does present the need to put a sheet over a door, it'll roll down off. And we do have multiple rooms that are video monitored, but not recorded. And it's a platform, bed, weighted chair. You know, they can still adjust their blinds by a little button, and it's very home-like. Key metrics. Our numbers wax and wane, of course. You can see the admissions, discharges, length of stay has come down. Right now, our length of stay is about 70 days. Seclusion events. And you'll see that number wax and wane, also 582, 390, 373, 44. And I'll get into that a little bit later, but that number is going to continue to always go up and down. And when I get into our IMD special service revenue down the road here, I will explain that, why that is, because we are taking in more high acute individuals, and that is drawing in greater revenue for us through the creation that we've made with altering our program. More examples on what we've done, not only for residents, but for staff too, where we have an exercise room for residents, we have it for staff, we have the congregate areas, and we have the main entrance as you guys see when you come in. This is, I want to really take a moment and, do I have one of those blue there? I could just see that, Avi. Or Richie. Yeah, Richie. I want,
Boy, he's getting mean today.
yeah.
Could have been worse, Avi.
Well, I know, don't believe me. These are case studies that are true success stories, and these are only 3 of hundreds that we have here, even in the nursing homes, of where individuals are being recovered in our community, in the nursing homes, in our IMD, where they come in. If you look at the first one, and again, these are not the names, are between myself and our architect. They did a beautiful job. Number 1, individual comes in acute crisis. Lori stopped her medications, leading to severe psychosis. She was found in a snowbank without shoes. true stories. Believing TV events were happening to her. She was hospitalized under Chapter 51 emergency detention due to danger to herself, 28 years old. Again, she's admitted to the facility. The treatment progress with the treatment team on number 3. Discharge. After steady progress and treatment, Lori was discharged to a group home ready for her next chapter. A few months later, we do follow-ups with our individuals. With continued stability and resilience, Lori transitioned back to her own home and regained her independence. Amazing. Here's another one, and I'll just kind of do the beginning and the end, and I just identify the middle like I.
She looks the same as the other one.
Little bit different.
It's the same woman.
This story is amazing. I'm very proud of the treatment team on all of these cases. Marie, 38-year-old individual diagnosed with schizoaffective disorder, was incarcerated after a domestic crisis. She spent nearly a year in jail refusing her psychotropic medications, leading to significant deterioration in her health. So, number 2, admission. Her presentation was striking, bizarre, dress, often covering her head, consumed by paranoia, hearing voices in the walls. She wasn't sleeping at all. The turning point, number 3. The real turning point was simply, but vital, we focused on her sleep. Once we stabilized her rest with the environment changes and medication, her thought process began to clear. Number 4, she went from fearful isolation to spontaneous and engaged. She transitioned to a group home where she did the hard work of repairing strained family relationships. Melt your heart on the end. Back home and thriving. Today, Marie is back home with her husband and 2 children, and they recently welcomed their 3rd child into the family. Her journey is a testament to the power of care, patience, and second chances.
That's good.
And the 3rd one is just amazing, because this is why we do our life events, and we get to know our people even before they come here, to find out strengths and weaknesses, and we try to build on strengths. This individual still keeps in contact with us. We're using the name Ken, 50-year-old who has bipolar disorder, the high intensity personality that made him a successful professional race car driver. Also made his mental health difficult to manage, eventually leading to substance use struggles. He came to Trempealeau County after a crisis involving intoxication and enrollment from a previous facility. He came in for treatment. He was admitted to the facility on number 2. Number 3, the challenges. He was ready to move forward, but barriers continued to stand in his way. At discharge, Ken was stable in a group home, but his home county was hesitant to let him move towards independence. And that's a key component to our program as we look at across the entire program. Is many counties, they're hesitant. They burnt their bridges. How can we get them to one of our community homes and then prove to them, I'm okay, and now I'm ready to move back home? That's what we did with this individual, and this individual actually moved to farmlands. Number 4, with this.
Sure, does that county pay for that as well then?
Yes.
Complete.
Yep. It's all under contraction.
All right.
Yep. So, which gives even a greater thing, and I'm still trying to get a second crisis bed here, but they're not proving it. And that's why back in the 2000s, early 2000s, when I was with the state, Terry Summer, the other administrator of mine, we worked directly with Phil here to get a crisis bed in this facility for these homes.
Yeah.
So then they didn't have to be shipped off to Winnebago and stuff. So if someone goes into a home and they have a crisis that we can potentially resolve in 72 hours, but they have to be under a commitment, we can bring them in for continuity of care and try to get them stabilized and then get them right back up. With the support of family members who provided a place to live and work, Ken proved he was ready. He's done the hard work and meeting all legal requirements to get his driver's license back and remains fully engaged in outpatient treatment. Looking ahead, he's back on track, driving towards the future. Today, Ken is finding ways to use his professional expertise again, exploring roles in research and driver development for racing teams. He's actually now started educating people on racing. He's not racing directly himself, but he will demonstrate and educate others. And he's also working, he has a full-time job. And he's back on track.
What is the timeline or when they first come in and tell, well, like.
This individual, I know, spent 3 months inpatient and 2 months outpatient, so there was less than 6 months. And he's back to reality of what he wants to do and how he wants to.
So this facility is helping a lot of individuals throughout the state.
Yep.
This gentleman returned back to his home then after he stayed it for a period of time.
Living with his aunt on the farm.
Nice. I apologize, guys. I've got a work meeting, so I'm gonna have to head out. So letting you know, but this is excellent. I'll keep reading it.
Jerry, not to interrupt you, but my thoughts kind of went with a lot of this too. More, obviously, the amount of time that they're staying here, I think helps for the longevity for them and their mental health. But how many patients do you actually run across? I think in some regards, it's good that they don't go back to their home site so early, that they transition to a different area, a different location. Because I think a lot of mental health triggers are your surroundings.
Environment.
Could be.
Of all of, whether it be people or
Family,
places or
friends, environment.
anything. And by staying out of that long enough and building a stronger mental health, you then can cope when you do get back to those surroundings. It almost seems like that should be the natural process, not a month or 3 months later, go right back to where you were before.
Correct. And that all starts inpatient here because we have a lot of individuals that we know struggle with environmental, they have, they don't have the ability to cease certain friendships that are actually inhibiting their progress and their life. And that is why having the creativity with the step down with our programs, and some counties will want to leave them here longer. And actually, because they haven't quite reached the strength to restructure their home-like environment, we meet with the counties with the patient that's present, and they will put them in another area till they gain that strength with the intent that they go home. But many people, that might take up to a year or even longer. And some people, they just can't quite get on track with that.
Hey, Jerry, can I ask, do you know why they wouldn't allow you a second crisis bed?
Because I sat with the state and I also sat, with the management team at the state. And the crisis bed we have is licensed for our building. I can expand that out, but there's so many criteria. Richie and I have this conversation all the time, that the one thing I cannot do, which the courthouse has always said, well, why don't you do this? Is that I cannot do the initial 72-hour emergency detention because of the licensure out here. Now, I continue to work with the state of Wisconsin to try to get an exemption, a waiver. They've given me different waivers. Even when we came into this building, I had to rewrite all of the waivers for the state of Wisconsin, and they definitely are not in support of that because they say that's what acute care and state hospitals are for. it's something that's always, they know when Jerry's coming to Madison that, yeah, he's gonna talk again. And it's something that I continue to strive for. One thing is that I have written a recent program with Dr. Percy. How can I expand that crisis bed? Because now that we contract out the mental health services and cover many counties, Dr. Percy is 4 hours for CSP with Trempealeau County only per month. So that's quite limited. But as we now have taken over Taylor County, Eau Claire County, Jackson County, and a couple of others, if they're within their treatment plan care, we are now able to intercept individuals from those counties versus going all the way across from to Winnebago. Again, there's a lot of legal criteria that I have to jump through to do that, but I'm very cognizant and very used to doing it in my 30+ years with more restrictive placements. And that has really driven up accessibility across the state of Wisconsin. And I'm the hearing officer for this facility. So when there's a lot of criteria for resident rights and stuff that has to be met. And we've been very successful in bridging those partnerships across the state of Wisconsin. So, but
Yeah.
they will not approve it. Again, even when I was on the state side, they will not do it, but I still have some strategies that I have in place. So
Well,
always something.
congratulations to having the one, and yeah, it is nice to have that access on, like you said, rather than sending everything to Winnebago, and it's nice to have people be able to stay closer to home.
And I was again very privileged to work with the previous administrator that just retired, semi-retired, and myself with Phil Borson, that from the state side of it, knowing the regulatory aspect that I do and Terry does, we were able to partner with Phil to get one. And we were the regulators on that end that pushed it through. And it's been a godsend. But again, even in our own community, it really is a positive thing for people that are in crisis. And
Yeah,
Richie,
keep working on
Yeah.
that 72-hour and get the licensed person you need, because every law enforcement officer in the eastern and the northern part of the state of Wisconsin will love you, Jerry.
yep. And the thing is, I am very creative with the regulations, because even though I've worked in acute care hospitals and acute care psychiatric facilities, there's always the 12-hour requirement for physician oversight. We were the first county organization to spearhead the whole telehealth. And that is becoming more and more, accessible for a lot of people. The one thing is that Medicare still struggles with what they will pay for, what they won't. So I meet with individuals on that portion too. But it's something that, as long as I'm here, that I'm not going to give up on. So
I'll hold you to it.
and yeah, I know you will. One time I need to take you to Madison with me.
I know.
I know you would.
I think you could get a lot of law enforcement
Oh,
right with
100%.
you.
Yeah, we'll move on to the next one. We're first going to go through this slide, and this has been a work in motion with the program adjustments for acuity that we have made inpatient for the IMD, and with Lori's partnership on the financial side of it. Thank you, Lori. We've been able to make some strong strides in revenue. As we know, the census waxes and wanes because people are being pulled out, either AMA, the counties will only pay for 30 days. We're seeing more and more AMA discharges where they're just dropping commitments, and we have many individuals that are being discharged to homeless shelters and to communities, and within weeks or 30 days are ending up back at the state hospital. So some of the counties need to be, we're continuing to educate them. They basically are establishing or they're identifying lessons learned, even though we educate people that when someone isn't ready, we don't support keeping people here longer than they need to be. So back in 2023, I had to start looking at this a little bit differently for our IMD. When we look at the daily rates, the state hospitals right now are over $1,700 per day. Some of the daily rates for the first 30 days are over $1,800 a day. We're at $425 a day. Again, because those dollars are allocated to counties, we still have to follow the Medicaid cost allowable manual, and please correct me if I'm wrong, Larry. So we still have to follow that menu or that book and that cost allowable manual. What happens is that some board members have said in the past too, Jerry, increase the rate to $1,000 a day. We can't do that because of our financial institution and our laws, accounting laws that we have to abide by. But what I was able to do and create is to adjust our program. We added, with your support, additional funds for magnetic locks, visual camera monitoring, supporting our positions that we have. And we've done a lot of restructuring with everyone sitting at the table with the guidance. And in 2023, by the additional add-on that we do, because we're bringing in a higher acuity of individuals that need one-to-one, whether it's for aggression to others, high suicide risk where they're under one-to-one observation, or someone's planted alongside of their side for 24 hours a day, I've been able to start trending and building this process. How can we do it safely? How can we staff it appropriately? How can we meet the needs of this higher acute population? Go ahead.
Quick question. Who makes that decision of one-on-one? Especially if they're coming from another county.
It is our assessment based on an RN, myself as the administrator and the physician.
You have a criteria.
Yes. Yep. So as you can see, the trend here, I had to come up with a way to identify, to offset some of our census dips, which part of that was farming our doctors out to different counties, which has increased intervening in these counties, where if they're seeing these patients, they can come directly here if we feel they're appropriate versus going to the state hospital. And again, it's still something that we're building every single day. But if you look at the financial additional revenue, 2023, $23,725. 2024, $89,865. 2025, $95,426. Now, 2026, and that's for the first
June.
through June, is $105,264. But Lori just ran me the new numbers, and you guys have a sheet, that separate sheet in your files there, that through the end of June, because that I think was through May.
Oh, I'm sorry, this is not updated. I think
No.
that was through March.
That was through March, but now through June, Josh is gonna put an additional slide up there, that our program is working. $161,066.98.
That's through June.
That's through June.
That is a big, wow.
So that's all creativity, knowing our licensure capabilities, bringing in team members to ensure that we can safely and securely do this to recover people, that we brought in a higher level. The counties, part of our ancillary costs, this is built into that. Again, even prior to, when someone goes in there, we have open dialogue to alert the county of the additional cost. And that's a way that we can offset certain dips in certain programs So we don't have to go on tax levy. But again, that's a treatment team component. And even though, yes, I'm the administrator and my role, these are decisions that I guide people. But the key here is to bring them along and empower them to have input. And that's very, very important.
And I think the other good point to make here, Jerry, is would you have been able to do this higher acuity creativity in the old building?
No.
Right. So this building has allowed us to be able to respond to a dip in the number of people that we serve, but yet there's a shift to higher acuity of people that we serve. So it's a definite response to what we're seeing out there as a need. So this building has allowed us to do that, where the old building would not have allowed us to.
And noting, going back to your other metrics survey, we have almost as many admissions and almost as much length of stays. And still increasing revenue. So,
Through
yeah,
acuity.
through acuity. So, yeah, it really makes a huge difference.
The special service revenue you're showing there through June, is there added expense to that? Maybe I missed something that you said, Jerry, but
So with that added, we utilize all hands on deck up here,
use what?
all hands on deck.
Okay,
So we don't hire additional employees.
that's what I was wondering.
Yep. So what we do is we might utilize an activity assistant. We might utilize if someone's on a monitor where it isn't a privacy or privacy concern with our consents for HIPAA privacy and so forth. We might have many individuals from many departments that all participate, including myself, that we will all provide that level of care. So it is definitely going in the right direction. Now, if I come back to you in a year from now or 6 months from now and that dips, that might happen.
Yeah.
Because this is a number that waxes and wanes. Now, the counties are not having any concern with this whatsoever because the other alternative, even at our 425 with the additional add-on expense, is still significantly lower than the state hospitals. So they're still saving money.
You're creative,
Yeah,
For me?
and that,
you're creative.
right, because it waxes and wanes through Jerry's creativity of his staffing. We can't, if we have a month of more than 1-to-1, we can't hire 5 staff.
Right.
Because additional staff, because the next month these folks may go home.
Yeah.
Or,
Yeah.
they're not, hopefully they're improving and they're not needing that 1-to-1. So that's a testament to staffing, creativity as well, because our staffing, our FTEs are not increasing necessarily based off of that. But, because it just changes based off of usage.
Who makes the decision when one is basically cleared to move on?
With taking the additional line of sight or 1-to-1 off someone, that is purely based on assessments by an RN and treatment team.
I see, yeah.
Yeah.
You said that.
So it's never one individual because we don't want one individual to have the liability increased on the facility. And I am part of those, our doctor is part of those.
Yeah.
And the treatment team, because these individuals all, because of their intensity, there's many different individuals that are assigned to them, specifically an AODA counselor. Someone might have been self-medicating themselves for quite some time, and we brought them off that. And they need to develop alternative coping skills. Same with the suicidal ideation. The RNs around the clock have to do a suicide assessment, which is documented. We've created it in the record. They have to do a face-to-face assessment. Plus, we have 4 licensed LPCs, licensed counselors that can do those too. And this person's assigned to a counselor to work on coping skills for those suicidal or more appropriate suicidal interventions, coping skills. And it's all a process. Now, does this last for months? No. We have one of them that was on 24 hours a day for 30 days because of the intensities and the trauma and all of the comorbidities that comes with this individual. That person now was on 1-to-1 around the clock for 24 hours a day for 30 days. And then all of a sudden, through treatment, had a light come on that, and through, maybe a polypharmacy also, because a lot of times an antidepressant, you're not going to see the effects of an antidepressant until you're at least 4 weeks into your program. So then, and now that person is totally off 1-to-1 and is being discharged next week.
Awesome.
So with the way you've been able to adapt and utilize the IMD portion, you'd have never been able to do that in the old facility. And so then having said that, when you look at other counties who are shutting down their county facilities as a whole.
Out of the 4 presentations, they're looking to us, even in different countries, With that being said, in this area, number one, the state isn't approving more IMDs because they have the beds in the state hospitals, and that's what they're committed to doing. And even with the more acute care hospitals coming up, that's only going to improve our business here. I was part of a work group with the state of Wisconsin when they were looking at giving more IMD exclusions. And they did do that to acute care hospitals. Does that affect us? None whatsoever. And I was part of that work group to ensure that we were protected out here. And what happened is that they did, because acute care hospitals do meet that criteria, what it did is gave more federal dollars to those acute care hospitals to maybe keep them for an additional week to see if they would stabilize. It's not really working or benefiting. Plus, because of the move that was made here and back in the early 90s, that we went state only, if other facilities decided to do this, they definitely could not survive because they would have to not take federal dollars, where they would have to look for state dollars, and they're not giving them out there right now. So if anything, it is getting us out there, showing them that we're quality, we're a bargain for your buck amongst many other facilities. So looking at securities, we talked about that too. And that's even what I have built in, is how do we protect the healthcare center? And we did this with their doctors even over at Winnebago, and now seeing the recommendations they're giving counties for us over here has driven up our business. Are they gonna get designs over here and stuff? No, they're not.
Thanks for being creative.
It's a team. It's truly a team.
Good.
And that's all I have.
Good.
All right, it's great. Our next monthly meeting is September 3rd at 11:30. Meeting adjourned.